we mentioned at the beginning that you are the IQILS Quality Lead. Could you just explain a little bit about IQILS and the benefit to patients?
So IQILS stands for Improving Quality in Liver Services, which is actually quite pertinent to what we've been talking about earlier on about access and models of care and how people interact with healthcare systems. And it serves two functions really. It's both an accreditation system, so like a kite mark, if you like, of liver services to say whether they're providing a requisite standard, but it's also about service improvement as well. Yeah. So it's a continuous improvement activity. So the IQILS process provides a framework through several domains. And actually one of the key domains is patient-centered care. And so what it does is it asks a series of questions of services. Say, do you do this? Do you do that? How do you do this? What are your processes around this? Do you provide support services? Do you ask patients for feedback? How do you respond to complaints? How do you respond to issues? How do you manage challenges like long waiting times and things like that? So they indirectly ask lots of questions of services to try and get an understanding of how good quality their service is. And then they upload evidence on a digital platform, and then that will allow them to get what we call level 1 accreditation. And then if they do that, we then open up a new set of standards, which are more detailed again, which if they work towards those, which they do with the team, then eventually they'll upload the evidence there, and eventually a site team will go out. That will involve people like myself or James Ferguson as assessors, going out there and looking at services, interviewing the staff. We have a patient representative as well who will interview patients. We will speak to the nursing staff. We will understand how the whole service fits together, how it interacts with patients, how it receives feedback, and how it actually functions. And at that stage, then they will be accredited at level 2 and fully accredited. So it's, as I say, it's not just a kite mark. It's about how we support services to continually improve. And in relation to PSC, there's no specific metric in there for individual diseases. We don't focus on individual diseases. We look at the whole system of care. What are your processes for receiving referrals from primary care, for example? So you're managing those at a timely fashion. Are you making sure you're diagnosing liver disease early enough? Yeah. Are you providing good mechanisms for people to feedback into the system? Have you got good pathways and processes of care in place? And are you able to respond to feedback from service users so that you can continually improve what you're doing? So I think for people with rare diseases like that, clinicians always like looking after rare diseases to try and support people who are really struggling with those things. If you can provide a mechanism whereby the whole care system gets better, there's lots of benefits to people who are living with PSC. And really, just finally, I want to say that Martin is heavily involved in the IQILS process and driving some of the standards. So the PSC community has been at the very the genesis of this scheme and will continue to be so over the years to come.